What's up, guys? Today I'm going to talk about selling Medicare supplements to someone who has Medicare Advantage. Now, first thought, we're not combining the two. Someone cannot have a Medicare supplement with Medicare Advantage. What I'm talking about is selling the idea of a Medicare supplement to someone with Medicare Advantage. Most of the sales that happen where someone buys a Medicare supplement plan after having Medicare Advantage, the sale is often done beforehand. Maybe they hated something about the Medicare Advantage product. Maybe they had a Medicare supplement in the past. They want to get back to it. Or maybe they've come across some marketing that has made them afraid of the Advantage plan, and now they're talking about Medicare supplements. But oftentimes a really skilled agent can use their knowledge of the difference between Medicare Advantage and Medicare supplement to sell against a Medicare Advantage plan to a Medicare supplement. Now, one of the easier sales is just going Medicare Advantage to another Medicare Advantage plan. But in a lot of rural markets, that's not a possibility, especially in some of the markets this year where a lot of Medicare Advantage plans in, say, Minnesota, Idaho, Maryland have left the market and/or gone non-commissionable. And so in those cases, it becomes necessary to try to think of how else can I add value. And one of the ways you can add value is bringing up the pros of a Medicare supplement. You'll find that a lot of these people were never offered a Medicare supplement. They don't understand the difference in traditional Medicare and Medicare Advantage. So this does come back to 101. As I wrote this, I wrote 1, 2, 3, network, out-of-pocket, 3, prior authorization, and bonus, dental, vision, and hearing. But there's a 0 here, and that's a 101. What I mean by that is, let's go back to the basics. What is the difference between Medicare and Medicare Advantage? The difference between Medicare and Medicare Advantage is simple. One is Medicare benefits administered through a private health insurance company, Medicare Advantage, and the other is traditional Medicare, which is government administered Medicare. Now, there are pros and cons to each. Traditional Medicare has an unlimited 20% coinsurance on Part B, and that has no maximum out-of-pocket. So there isn't a bigger out-of-pocket potential there. There's no additional benefits like dental, vision, and hearing, some of the other things that might be offered on Medicare Advantage. There's also some runaway hospital daily copays and hospital deductibles on there. But on a Medicare Advantage plan, you do have the maximum out-of-pocket. However, you are going on to a plan that has a network, sometimes a smaller limited network, sometimes a network that requires referrals. People aren't often sold that as a negative. They're trying to sold it as a benefit, or it's ignored in some of those previous conversations. So bringing it back to a 101, when you determine this is someone who might benefit from going back to traditional Medicare and having a Medicare supplement, it would be getting the basis of understanding how healthcare works on the Medicare system. Then we want to get into harping on some of the things that are pain points of Medicare Advantage. The network, just like we talked about, if you have an HMO plan, you might have to get a referral from your primary care provider to a specialist. That's something people don't tend to like. It's a little bit of a nuance. And then you might have to stay within a limited network. Maybe there's a surgeon that I want to see, but they're not a part of the HMO. Even with a PPO, though I can go outside of the network, I'm going to pay more. I may even run into some billing issues, because typically a provider that's not part of a PPO, even though the plan will pay them for services, they may not like to file that carrier. That may be the reason that they're out of network. So sometimes you could end up having to file some of your own paperwork, or even as an agent, you might have to step in and help them file paperwork for claims, which is not our specialty. Then we have the out-of-pocket. What is the out-of-pocket? Now, a lot of times when you're selling Medicare Advantage, agents like to focus on the small out-of-pocket. Oh, primary care copay, specialty copay. But it's the daily hospital benefits, the 20 to 30% co-insurance associated with chemo and radiation and kidney dialysis, and then the maximum out of pocket, which in some cases can be $6,000, $7,000, $8,000, $9,000 on some plans we've seen across the country. So you could still have a significant out of pocket. Now remember, as we said, we're comparing it to traditional Medicare where there is no out of pocket, and so Medicare Advantage over traditional Medicare alone might have a pro in that regard, but with a Medicare supplement, we could have almost no or very little out of pocket if they could get approved on one. Now, number 3, prior authorization, probably the biggest thing to sell against Medicare Advantage on right now. This is, the whole concept of taking the choice away from the beneficiary and the doctor and putting it in the arms of the, or the hands of the insurance carrier on whether a procedure will get approved. Now, when we're looking at Medicare Advantage and selling Medicare Advantage, we can kind of, put that into context appropriately. Most times when prior authorization is requested, it is approved. Most of the times, if it is denied on appeal, it is approved. So it is probably made out to be worse than it is, but it's still an inconvenience, and it's something that people don't like to have to deal with. And even though there is prior authorization coming in phases to traditional Medicare, it's small and nuanced in comparison, and it's being phased in, over time, whereas Medicare Advantage prior authorization currently exists in its fullest form. So prior authorization is something to certainly harp on. And so we say, hey, when we're looking at Medicare supplements over Medicare Advantage, how would you like to go to pretty much any doctor you want to that takes regular red, white, and blue Medicare? You go to the doctor and almost all of the bill is paid for. You walk in and out. You don't have a whole bunch of copays. There's no prior authorization, all of that kind of stuff. That's a very typical way to frame the differences, right? Now, there might be nuances. You might say, hey, there are certain aspects of prior authorization coming, but much less than you're dealing with now. Another concept here, though, is at some point, this is going to give you the opportunity to sell additionally dental, vision, and hearing. I used to would have said additionally Part D, but as most Part D plans are non-commissionable now, this may not be a great income earning opportunity to sell the Part D plan. But of course, if you're going to bring someone off of Medicare Advantage to a Medicare supplement, you do have to enroll the Part D. Now, if you're doing this in AEP, when you submit the Part D application for a January 1st effective date, that will kill the Medicare Advantage plan effective January 1st. That is when you would have the Medicare supplement plan go into effect, okay? So the bonus tip on the dental, vision, and hearing is that when you're coming off Medicare Advantage, a lot of these people are losing the dental, vision, and hearing benefits of Medicare Advantage. Traditional Medicare doesn't have that, so it doesn't present an opportunity to cross-sell a standalone dental, vision, and hearing plan. We love a few plans out there with Manhattan Life, Cigna, Aetna. There's a lot of plans out there like that, MetLife. So lots of plans to choose from. If you would like information on any of those dental, vision, and hearing plans, or if you'd like to get training like this every Tuesday, Wednesday, and Thursday live, let us know in the comments, and also reach out to our team. You can reach out anytime by emailing us at support@BobbyBrockInsurance.com. Thank you, and head over to justinbrock.com, and we'll see you at the next Behind the Agency or Agent Boot Camp. Check us out.